Hi, I'm Dr. Madhuri and I'm from Évoluer Aesthetics and Plastic Surgery. So today's topic is Botox and Fillers. So let's talk about Botox. What is this Botox? I'm sure you would have heard about celebrities getting Botox from all the Hollywood, Tollywood, Collywood and everywhere. So the reason is that anti-aging magic which instantly shows up in your skin. So now we need to know about what exactly is this. Botox is a neuromodulator which temporarily paralyzes the muscle fibers so that there is no movement of the muscle. Once there is no movement of the muscle, the skin over the muscle does not cause a wrinkling effect and does not show up the aging lines. Now let's talk about fillers. Fillers is also an anti-aging procedure where the content of the filler is hyaluronic acid. The hyaluronic acid is injected into the skin so that the anti-aging effect is instantly visible. When we fill in the hyaluronic acid in the skin, it absorbs a lot of water content from the external and the internal tissue levels and it swells up in size. Eventually, it will convert into connective tissue and collagen and also result in a filling effect in that particular area. So the filler is very helpful in those spaces where there is a volume depletion. For example, when we say there is aging in a face, we usually encounter a volume depletion. So we are refilling that area where there is a volume depletion and that area will look more plumped up and more youthful. Do you need a Botox or a filler? Now how to choose in between these two? Most of my patients are absolutely confused and they actually don't know what is a Botox and what is a filler. Now basically we know right now the difference between the Botox and the filler. Here in the Botox we are just concentrating on the muscles and whereas the fillers we are concentrating on the volume of the face. So the Botox is only a temporary product which is going to stay for quite some time, probably like 6 weeks to 12 weeks, depending upon the area that we put and also depending upon the Botox that we have chosen. And whereas filler stays for quite a long time, which ranges up to 6 to 12 months, depending upon the place that we have put in the filler and also what kind of filler that we used. We need to understand that these both are anti-aging processes. Aging is absolutely inevitable. We need to understand this fact. But everybody has a right to age gracefully. So I believe that these products that we are going to use for anti-aging does not cause a maximum of a harm to anybody unless and until there is a toxicity of it. However, there is a limitation to all these anti-aging processes where there's a limit to usage of a Botox as well as there is a limit to usage of the fillers. These two processes or these two products can go hand in hand in the area that is concerned. We can do a Botox as well as a filler together, but we cannot do the Botox and the filler for the same requirement. The Botox can only be given to the muscle, as we know this. The filler can only be given to the area where there is a depletion of the volume. This has to be really clear to understand because the aging depends upon two different things. One is the muscular activity of the face. One, the fat loss that happens due to aging. There's also another component which is very important for aging, that is your skin aging. Skin aging depends upon the dehydration level of the skin, which is really important factor to understand that what goes behind an aging process. So unless and until these underlying factors are absolutely corrected, we do not get an achieved result in responsive to the aging process. How do you know that you are a Botox candidate? Choosing a Botox. Most of my patients have a confusion and they come to me and say, Doctor, I want Botox here. I want a Botox here. Do they even know what they are saying? The confusion is, we know clarity that the reason we do the Botox is to reduce the wrinkles. But when the patient is saying that I want Botox here, there are no wrinkles actually here where we can actually use the Botox there. But we need to understand that they are also talking about fillers where they are not aware of. First and foremost, we need to understand and have the awareness of that there are two different things. One is Botox and one is fillers. Another thing, when we are doing Botox, there are different areas at which the concern can be corrected. First thing is the forehead lines, the crow feet, these lines which are called bunny lines. These lines appear because there is a muscular activity, and this causes aging lines, right? So when we do the dynamic movements of the muscles, it is very highly evidently visible. So now this can be paralyzed for temporary purpose, in the sense temporary time being, so that we don't see much of the movement of the muscle. However, wherever there is Botox put in that particular area, say crow feet or these lines, you see a bright glow in that surface and also no movement of the muscle. Some of the patients might feel a little difficult for initial 2 to 3 weeks, after which they get used to the no movement of the muscle. However, the whole process of injecting Botox is absolutely individual and also depending upon the injector who is doing it. It is always important that we choose the best injector to do this, because as long as you are in the safe hand, nothing will go wrong. So always choose wisely and also do a lot of research before choosing a doctor, especially for these procedures like Botox and fillers, because thorough anatomical knowledge is really important, and if anything goes wrong, there is also a side effect to it. So we should be very careful while doing this procedure. So the side effects or complications that we can encounter with Botox is infection, necrosis, and site of injection infection. If all these things we can only see when there is no proper sterility in the place that we are getting the Botox done. Another thing is there is ptosis of the eye, and there's also other thing, the tear duct getting blocked. That's one more major complication that generally it's encountered. And as we all know that Botox is a neuromodulator, because it's going to paralyze the muscle. It also makes it very difficult for someone who's not used to Botox, because it will absolutely flatten all the lines and there is no muscular movement. Someone who's really very anxious, they end up having more anxiety levels, and this we have observed in those patients who never got it done. They have to be mentally prepared to get this done. And also this particular product cannot be reversed. There is no reversal of it. Once it's wrong and it is getting difficult for some complication to get, we need to just wait for it to wear off. There is no reversal of this particular complication. That's one thing. Some complications like migration, that movement of the Botox is some other muscle, and that muscle has other odd effect, say drooping of one side, and there is asymmetry of the face of the one side, and all this. If all these we encounter when the injection is not done proper, or the injection is some other muscle where we intended to give one particular muscle. So all the factors will count down to only one thing: choosing the best clinic, choosing the best doctor, and also do a bit of research about what goes inside the product. And the main important thing is, once we choose a Botox, we have to be prepared that this, whatever goes inside our tissues or skin, will not be removed for 3 to 4 weeks till the effect is there. So once they are prepared, you'll be mentally prepared to get the procedure done, and it will go smoothly. Unlike Botox, fillers are not that kind. There is a possibility of reversal of material, provided you are using a filler which can be reversed. There are some undissolvable fillers and dissolvable fillers. However, this only is subjective, and it is only indicated in the places where we really have to reverse it. Say if there is any complication that has occurred, that is when we take a step ahead to go to reverse that filler injection. Unlike Botox, we do not have any unit specificity for the filler. Filler comes in the volume of mLs. So we choose this like 1 ml, 2 ml, 3 ml, depending upon the amount that we want to use and also how much of the amount that is required. Another major difference is this filler does not paralyze the muscle. It only builds up hyaluronic acid volume inside the space that we have put in. So there is no constriction of the muscle fiber or paralysis of the muscle temporarily. Of course, there will be a lot of hydration for which you will feel tightness over the skin, and fillers is more filling, so you see evident result. whereas Botox you start seeing the result after 3 to 7 days depending upon the number of units that we used and the concentration that we have used. I have so many patients coming up to me and saying that Botox is way more cheaper than the fillers. I want only Botox. But actually that particular patient might require the fillers more than that of Botox. Now how do we choose to give which one to give? As we all know that this is a neuromodulator and this is a filler, that is a material to be filled. We need to understand the indications properly, what is required, and then choose amongst these or both together. The patient has to be educated. The patient should be aware that what he really requires or she really requires and how much of the amount is required. Now costing totally depends upon the number of units that we use and the indication for which we are using. Of course, Botox is way more lesser priced than that of a filler. Also, we need to understand that the long lasting capacity, when we compare as the filler and the Botox is less number of days in compared to that of the fillers. However, these two are complete different entity. We should not be confusing it. It's only for the information that we are giving about the price differences. The pricing is generally done based on the number of units that we use. It is 1 unit, 2 units and 3 units. And however, see, individual areas requires individual number of units. Say example, we need to do the forehead. We might require around 20 to 30 or maybe 40 into some individuals who have maximum of lines or lot of static lines. So that is how we choose, and say minimal we might require 15 to 20. However, the choice totally depends upon the doctor and the individual that we are choosing to give and the indications that we are doing and also the material that we have choose to give. So these are all the factors we need to consider before giving the Botox. So Botox, as we know that we charge according to the unit wise. So each unit is varying prices, and it starts from 250 rupees Indian currency to probably 400, 500 and 600, and it is individual to the clinic and the area and the doctor and the specialty. So it's absolutely the material that we use, the expertise that we are using when it comes to the pricing. Now fillers is not like that. Fillers comes like in ml form, like I told before, and to know the details about the fillers and how exactly is this fillers going to work on us, please check out the video which I already spoken in the YouTube channel. So where the fillers is amounted according to the number of ml that we use. For example, if we are say 1 ml, it ranges from 25,000 to 35 and 45,000 as well, and it totally depend upon the number of ml that we are using, the product that we have chosen, the indication for which we are doing, and several other factors. So we need to consider that. So the Botox and the fillers are two different entities. Please do not confuse both of them.